Dear viewers, this video is part 2 on the basic facts on the liver in Prescribon medical education series. Continuing on the discussion, regulation of liver mass, that is regeneration. The liver possesses a remarkable ability to restore itself after significant hepatic tissue loss from either partial hepatectomy or acute liver injury, as long as the injury is uncomplicated by viral infection or inflammation. Partial hepatectomy, in which up to 70% of the liver is removed, causes the remaining lobes to enlarge and restore the liver to its original size. During liver regeneration, hepatocytes are estimated to replicate once or twice, and after the original size and volume of the liver are achieved, the hepatocytes revert to their usual quiescent state. Note: normal liver weight is re-established within 8 to 15 days. Hepatocytes and cholangiocytes function as facultative stem cells and transdifferentiate, that is, change of cell type to another type of cell into each other to restore normal liver structure. Hepatocytes have an unlimited regenerative capacity. Control of this rapid regeneration of the liver is not well understood. But hepatocyte growth factor HGF appears to be important in causing liver cell division and growth. HGF, hepatocyte growth factor, is produced by mesenchymal cells in the liver and in other tissues, but not by hepatocytes. Blood levels of HGF rise more than 20-fold after partial hepatectomy, but mitogenic responses are usually found only in the liver after these operations, suggesting that HGF may be activated only in the affected organ. Other growth factors, especially epidermal growth factor and cytokines such as tumor necrosis factor and interleukin 6, may also be involved in stimulating regeneration of liver cells. After the liver has returned to its original size, the process of hepatic cell division is terminated. Again, the factors involved are not well understood, although transforming growth factor beta, a cytokine secreted by hepatic cells, is a potent inhibitor of liver cell proliferation and has been suggested as the main terminator of liver regeneration. Physiological experiments indicate that liver growth is closely regulated by some unknown signal related to body size, so an optimal liver to body weight ratio is maintained for optimal metabolic needs. Dear viewers, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Now, coming back to discussion. In liver diseases associated with fibrosis, inflammation, or viral infections, however, the regenerative process of the liver is severely impaired and liver function deteriorates. The hepatic macrophage system serves as a blood cleansing function. Blood flowing through the intestinal capillaries picks up many bacteria from the intestines. Indeed, a sample of blood taken from the portal veins before it enters the liver almost always grows colon bacilli when cultured, whereas growth of colon bacilli from blood in the systemic circulation is extremely rare. Special high-speed motion pictures of the action of Kupffer cells, the large phagocytic macrophages that line the hepatic venous sinuses, have demonstrated that these cells efficiently cleanse blood as it passes through the sinuses. When a bacterium comes into momentary contact with a Kupffer cell, in less than 0.01 second, the bacterium passes inward through the wall of the Kupffer cell to become permanently lodged therein until it is digested. Probably less than 1% of the bacteria entering the portal blood from the intestines succeeds in passing through the liver into the systemic circulation. Metabolic functions of the liver. The liver is a large chemically reactant pool of cells that have a high rate of metabolism. These cells share substrates and energy from one metabolic system to another, process and synthesize multiple substances that are transported to other areas of the body, and perform myriad other metabolic functions. For these reasons, a major share of the entire discipline of biochemistry is devoted to the metabolic reactions in the liver. Major metabolic functions. Carbohydrate metabolism. In carbohydrate metabolism, the liver performs the following functions. 1. Storage of large amounts of glycogen. 2. Conversion of galactose and fructose to glucose. 3. Gluconeogenesis. Note, gluconeogenesis is a process that transforms non-carbohydrate substrates such as lactate, amino acids, and glycerol into glucose. 4. Formation of many chemical compounds from intermediate products of carbohydrate metabolism. The liver is especially important for maintaining a normal blood glucose concentration. Storage of glycogen allows the liver to remove excess glucose from the blood, store it, and then return it to the blood when the blood glucose concentration begins to fall too low, which is called the glucose buffer function of the liver. In a person with poor liver function, blood glucose concentration after a meal rich in carbohydrates may rise to 2 to 3 times as much as in a person with normal liver function. Gluconeogenesis in the liver is also important in maintaining a normal blood glucose concentration because gluconeogenesis occurs to a significant extent only when the glucose concentration falls below normal. Large amounts of amino acids and glycerol from triglycerides are then converted into glucose, thereby helping to maintain a relatively normal blood glucose concentration. Fat metabolism. Although most cells of the body metabolize fat, certain aspects of fat metabolism occur mainly in the liver. In fat metabolism, the liver performs the following specific functions. 1. Oxidation of fatty acids to supply energy for other body functions. Synthesis of large quantities of cholesterol, phospholipids, and most lipoproteins. Synthesis of fat from proteins and carbohydrates. About 80% of the cholesterol synthesized in the liver is converted into bile salts, which are secreted into the bile. The remainder is transported in the lipoproteins and carried by the blood to the tissue cells of the body. Phospholipids are likewise synthesized in the liver and transported principally in the lipoproteins. Both cholesterol and phospholipids are used by the cells to form membranes, intracellular structures, and multiple chemical substances that are important to cellular function. Almost all the fat synthesis in the body from carbohydrates and proteins also occurs in the liver. After fat is synthesized in the liver, it is transported in the lipoproteins to the adipose tissue to be stored. Protein metabolism. The body cannot dispense with the liver's contribution to protein metabolism for more than a few days without death ensuing. The most important functions of the liver in protein metabolism are the following. 1. Deamination of amino acids. Formation of urea for removal of ammonia from the body fluids. Formation of plasma proteins. Interconversions of the various amino acids and synthesis of other compounds from amino acids. Deamination of amino acids is required before they can be used for energy or converted into carbohydrates or fats. A small amount of deamination can occur in the other tissues of the body, especially in the kidneys, but it is much less important than the deamination of amino acids by the liver. Formation of urea by the liver removes ammonia from the body fluids. Large amounts of ammonia are formed by the deamination process, and additional amounts are continually formed in the gut by bacteria and then absorbed into the blood. Therefore, if the liver does not form urea, the plasma ammonia concentration rises rapidly and results in hepatic coma and death. Indeed, even greatly decreased blood flow through the liver, as occurs occasionally when a shunt develops between the portal vein and the vena cava, can cause excessive ammonia in the blood, an extremely toxic condition. Essentially, all the plasma proteins, with the exception of part of the gamma globulins, are formed by the hepatic cells, accounting for about 90% of all the plasma proteins. The remaining gamma globulins are the antibodies formed mainly by plasma cells in the lymph tissue of the body. The liver can form plasma proteins at a maximum rate of 15 to 50 gram per day. Therefore, even if as much as half the plasma proteins are lost from the body, they can be replenished in 1 or 2 weeks. Plasma protein depletion causes rapid mitosis of the hepatic cells and growth of the liver to a larger size. These effects are coupled with rapid output of plasma proteins until the plasma concentration returns to normal. With chronic liver disease, example cirrhosis, plasma proteins such as albumin may fall to very low levels, causing generalized edema and ascites. Among the most important functions of the liver is its ability to synthesize certain amino acids and other important chemical compounds from amino acids. For example, the so-called non-essential amino acids can all be synthesized in the liver. Other metabolic functions of the liver. The liver is a storage site for vitamins. The liver has a particular propensity for storing vitamins and has long been known as an excellent source of certain vitamins in the treatment of patients. The vitamin stored in greatest quantity in the liver is vitamin A, but large quantities of vitamin D and vitamin B12 are normally stored there as well. Sufficient quantities of vitamin A can be stored to prevent vitamin A deficiency for as long as 10 months. Sufficient quantity of vitamin D can be stored to prevent deficiency for 3 to 4 months. Enough vitamin B12 can be stored to last for at least 1 year and perhaps for several years. The liver stores iron as ferritin. Except for the iron in the hemoglobin of the blood, by far the greatest proportion of iron in the body is stored in the liver in the form of ferritin. The hepatic cells contain large amounts of a protein called apoferritin, which is capable of combining reversibly with iron. Therefore, when iron is available in the body fluids in extra quantities, it combines with apoferritin to form ferritin and is stored in this form in the hepatic cells until needed elsewhere. When the iron in the circulating body fluids reaches a low level, the ferritin releases the iron. Thus, the apoferritin-ferritin system of the liver acts as a blood iron buffer as well as an iron storage medium. The liver forms substances used in blood coagulation. Substances formed in the liver that are used in the coagulation process include fibrinogen, prothrombin, accelerator globulin, factor VII, and several other important factors. Vitamin K is required by the metabolic processes of the liver for the formation of several of these substances, especially prothrombin and factors 7, 9, and 10. In the absence of vitamin K, the concentrations of all these substances decrease markedly and almost prevent blood coagulation. The liver removes or excretes drugs, hormones, and other substances. The liver is well known for its ability to detoxify or excrete many drugs into the bile, including sulfonamides, penicillin, ampicillin, and erythromycin. Several of the hormones secreted by the endocrine glands are also either chemically altered or excreted by the liver, including thyroxine and essentially all the steroid hormones such as estrogen, cortisol, and aldosterone. Liver damage can lead to excess accumulation of one or more of these hormones in the body fluids and therefore cause overactivity of the hormonal systems. Finally, one of the major routes for excreting calcium from the body is secretion by the liver into the bile, which then passes into the gut and is lost in the feces. Many substances are excreted in the bile and then eliminated in the feces. One of these substances is the greenish yellow pigment bilirubin, which is a major end product of hemoglobin degradation. Fate of red blood cell. Hemoglobin is released from aged red blood cell. Normal RBC lifespan is 120 days. Hemoglobin is taken up by tissue macrophages in the reticuloendothelial system and split into free iron and free bilirubin, that is unconjugated bilirubin. Free iron is transported in the blood. The free bilirubin is taken up by the liver cells and conjugated to form water-soluble bilirubin, that is conjugated bilirubin. The water-soluble bilirubin is excreted in bile and then into the intestines. Jaundice. Excess bilirubin in the extracellular fluid. Jaundice refers to a yellowish tint to the body tissues, including a yellowness of the skin and deep tissues. The usual cause of jaundice is large quantities of bilirubin in the extracellular fluids, either unconjugated or conjugated. Bilirubin. The normal plasma concentration of bilirubin, which is almost entirely the unconjugated form, averages 0.5 mg per deciliter of plasma. In certain abnormal conditions, this amount can rise to as high as 40 mg per deciliter. The skin usually begins to appear jaundiced when the concentration rises to about 3 times normal, that is about 1.5 mg per deciliter. So, dear viewers, this is the end of part 2 in this series. For the other video, see Prescribon Medical Education series, Basic Facts on the Liver. Thank you viewers again for watching the video.